And once we understand that and get that clearly, then we'll begin to achieve our goal. Thank you so much to the council president. Thank you.
From the YWCA.
Whip for Cleveland City Council, and I am also the chair of the Health and Human Services Committee. Today we're here because we want to basically say thank you to the community for supporting the resolution that we passed this week, Resolution 296-2020. And it states and it declares that racism is a public health crisis. It is truly a sobering moment in the city of Cleveland at this time, when all of us are forced to reflect on how did we get here? How did the city get to a point where so many people are frustrated and passionate about reform? But that reform is not just what's needed in the police department. Racism exists in all of the systems that we have across this city. It has caused health disparities. It has caused economic disparities. It has caused disparities in the amount of affordable and quality housing that we have in the city of Cleveland. And yes, it is also a civil rights issue, and it is also a public health crisis. So we stand today because after 400 years, after Jim Crow laws, after redlining, after policies that have held a certain community, in this case, African American community, back, where we have higher rates of infant mortality, we as a city council have used the voice of one of the most powerful institutions in the city of Cleveland, Cleveland City Hall, to state that racism is a public health crisis. So here today you see internal and external partners that are working with us. You also have had several statements from the Greater Cleveland Partnership, which is our Chamber of Commerce, all of the major medical institutions.
Thank you, Councilman Griffin, and thanks for your leadership on this and everything that you did to make this a reality. Anybody who would suggest that race is not part of our health outcomes is living in a state of willful ignorance. If you look at heart disease, diabetes, infant mortality, lead poisoning, and yes, homicides and other social illnesses, the link between race and health outcomes cannot be denied. In fact, it's been before us for longer than we should be embarrassed to admit. Back in 2001, it became a federal issue, and in 2003, Congress mandated that we produce a national health disparities report. Well, that was 2001 and 2003. Well, now it's 2020. That's why I'm glad the Cleveland City Council finally said enough. We're going to stop talking about this. We're going to stop letting this just happen without your government, your city, having an effective response to this. But to be successful, we are going to need government, we are going to need the private sector, we're going to need the philanthropic sector, we're going to need everybody to stop denying that this is not an issue in health outcomes. We're going to need to tackle this head on, and everybody's going to have to do that together. The most heartening question that came from many people during all of our discussions of racism and health as a public health crisis is, what are we going to do? Is this just going to be another resolution that the City Council passes, or is this going to be a call to action? I'm here to tell you this is going to be action. We are required to put together a working group, to put together a plan, to put together policies to make sure that this is not just something that council was resolved to do. This is something we are going to do. We are going to have a plan, and I'm not talking about in 2021, I'm not talking about in 2022. We're going to start working on this immediately because we are long overdue on recognizing this and acting on this. So again, thank you everyone that's here. Thanks my colleagues. I have this Wednesday, even though we were in a Zoom meeting, which was kind of a Zoom meeting, one of my proudest moments on council when we passed this, because we really came together and did something good, not just for a ward or for a small item. We're taking a look at how are we as a city going to care for our people going forward. So I'm very proud to say that. And one of our main sponsors of this is my colleague, Councilman Kerry McCormick, who's been very helpful in pushing this forward. And at this point, I'd like to introduce...
I'm the president for the Cleveland branch of the NAACP, and I just want to say thank you to all of our elected officials that are here today that fought alongside of us to be able to make this a reality. I'll be very brief in just saying that you cannot solve a problem if you don't identify that problem. And so calling racism a public health crisis is a simple, basic tenet in trying to have problem resolution. We spend a lot of time in our community dealing with things that are symptoms of a problem that we previously refused to identify. When we think about violence, when you think about lack of access to affordable housing, to health care, to quality education, to opportunities when it comes to employment and business ownership, the one common thread and the one common thing that bands all those things together is systemic racism. And by declaring this as a public health crisis, it requires our legislators to put together legislation that's going to solve the problems. It also voluntarily allows our corporate and civic community to come together and say, we identify this as a problem as well, and we want to lock arms with you to create solutions. As a Black woman who leads in this community, it's disheartening to know that in almost every single poll and study that's out there, Black women fare worst and at the bottom in the city of Cleveland when you talk about education outcomes, business, health, and some of my colleagues are going to talk specifically about maternal health and infant mortality. But I live this on a day-to-day basis. And so that's why I'm proud to be a part of the group that was willing to name this as a crisis. But I'm also optimistic and encouraged by the community response that we realize we won't do this by ourselves. We are a mighty team of Avengers, as my brother has just so eloquently stated. But we need more Avengers on this stage with us to ensure that this problem is eradicated, not only in the city of Cleveland, but in this region, in the state, and across the country and the world. Thank you so much, and next I'll introduce my colleague from Birthing Beautiful Communities, Kristen Farmer. Thank you.
Talked about, and our sister just said, which is very important, is that we also want to see other organizations create specific action steps of what they're going to do to begin to become more equitable. And that's what we're calling on as well. And I want to make sure that I say this, because the community will always be upset and angry when you have situations like Desmond Franklin, a young boy who was recently shot and killed, and officers have not been brought to the table. We have to do these type of things. So every organization, along with what Chairman Griffin said, Mr. Boomer, is that we are expecting organizations to not just send emails, not just say that we're with you, but we want to see some action steps from Cleveland Clinic, from Metro, from University Hospital, from Key Bank, from every other bank. What are the actionable steps that you will put in place to increase people of color in upper management, to increase investment into quote-unquote urban communities? We don't want this moment to just go past. And to everybody out there, looting does not honor the dead. The way that we honor George Floyd and Desmond Franklin and Sandra Bland and Tanisha Anderson and Timothy Russell and Melissa Williams and Breonna Taylor and all of the countless names, the way that we honor them is by making sure that we create a system that don't lead us back down this path.